Hello, welcome to today's webinar. Today's presentation will be by Dr. Fay Johnston of the Menzies Institute for Medical Research at the University of Tasmania. Today's webinar is a collaboration between our New Zealand colleagues and they're from the International Wood Smoke Researchers Network, which is funded by the National Institute of Water and Atmospheric Research. And the CAR Centre, which is the Centre for Air Quality and Health Research and Evaluation. Fay will be presenting on interventions to address poor air quality from wood heaters, efforts from Tasmania. So Fay is a public health physician and environmental epidemiologist, and she's recognised for her expertise in the health impacts of outdoor smoke from bushfires, prescribed burns, wood heaters and other solid fuels. She likes to work closely with government agencies and practitioners to develop and implement applied policy relevant research. So I'll now hand over to Fay. If you do have questions, please type them in and she'll get access to those. Thank you very much.
Thanks very much, Amanda, and hello everybody, and thank you to NIWA and the Wood Smoker Researcher Network and to CAR for the invitation to present today. So I'll get right into it. I'll share my screen. Thank you to NIWA. Get started. And to CAR for the invitation to present today. So I'll get right into it. I'll share my screen. Okay, sorry, I think we're away. Okay, so I'm going to tell you some sort of applied efforts in research from Tasmania. I'll begin by giving you a bit of background to the state and then describe some of the research that we've done over the years, and be very interested in your feedback on any aspect of this, because it's certainly a problem that's not going away. So just to begin, particularly for those of you who aren't located in Australia, Tasmania is one of the states. It's the island to the south of the mainland, coloured in here in orange. And here's an enlarged version where you can see there's two main towns, Hobart and Launceston, and nearly all the studies I'm presenting today were either done in or in the very small towns around Launceston. And the population distribution, it's only 500,000 in the entire island state. About half live in and around Hobart, the capital, and the other half are mostly spread along the north and the northwest coast here, with 100,000 roughly in Launceston, which is here. So compared with the rest of Australia, Tasmania's furthest to the south, that has the coldest climate of all the states. Socio-economic disadvantage is greater. On nearly any indice you look at, it's overall poorer than the Australian average. It's older, we are older, the median age is higher. Most indices of health, such as mortality or chronic disease admissions, show Tasmania to be worse than the national average. And compared to the highly urbanised cities of the mainland states, we're far more rural, and more than half the population lives in quite small rural towns. So they have access, we're very wooded, we have a forestry industry, there's lots of trees, very easy access for wood fuels. So compared with the rest of Australia, we have quite high rates of heating with wood. Currently it's 30%, but it's always been at least 50% in the smaller towns. And this shows you the choice of heating since the 1970s in Tasmania. And wood heaters are represented by this top line, the blue diamonds. And popular back in the 70s, oil got a bit of a look in until oil prices doubled almost overnight in the 1970s. And then wood heater use just took off, and it peaked in the big cities. It was always high in rural areas, but around 1990. And then after that, over the next 20 years, there was a gradual falling off with replacement by electricity, which in Tasmania is largely hydroelectricity. So this plot of wood heater use doesn't necessarily reflect air quality because it's very dependent on where the geographic and the meteorological situation of each particular town. So in a place like Launceston, it caused extremely poor air quality. In Hobart, it was less of an issue, much better atmospheric dispersal. There's been suggestions, of course, in recently that wood heater sales are booming and concern that pollution is worsening in some parts of Tasmania. And we've recently got our 2016 survey results, which indeed confirm that belief. And we can see wood heater use creeping up again. It was 25% in 2010. We're now at 30% overall. And it's come at the expense of electricity on the whole, which has got quite expensive. Okay, this slide is to give you some background for the same time period from the 1970s of the regulatory context, and this is an Australia-wide context. The red line I'll talk to first, this red line here that steps down, and that corresponds to the right-hand axis. And these are the standards, the emission standards for wood heaters in Australia through time. Here, the standards are expressed as grams of PM per kilogram of fuel. So it's not an hourly standard, it's based on the mass of the fuel. The first standard was introduced in the 1990s, around the time that wood smoke was recognised to be an enormous problem. It was tightened again to 4 grams per kilogram late 1990s. And just recently, it's been tightened again, 2015, with an expectation it will be tightened again in 2018. So they have been the gradual emission standards. And the blue line here shows the PM10 standards. So they're the outdoor air quality standards. Australia actually didn't have a standard until 1998, and it was introduced at 50 micrograms per cubic metre. The 150 were some international standards, US EPA, for example. But Australia introduced their own here. And then in 2015, we introduced our own PM 2.5 24-hour ambient air quality standard at 25. So 50 for PM10 and 25 for PM 2.5 are our current standards. Whether this increasing emission standards has resulted in reduced pollution is uncertain, but we certainly know from studies done by NIWA, studies done by CSIRO here in Australia, that while it's possible to burn them to get these low emissions with the newer stoves in a way, and it's still possible to take a new stove and burn in a highly polluting way. So it means low emissions are possible, but not foolproof. Okay, so that's the background. And what I'll do now is tell you about 2 studies. The first one was done quite some time ago in Launceston, and that related to a buyback scheme for wood heaters. And then more recently, there have been efforts to reduce pollution from heaters by not doing buybacks, by implementing other measures. And these most recently were done along the river, the South Esk River, in small communities that are located close to Launceston. But first, I'll tell you about Launceston. So as I showed you before in the pattern of wood heater use, that was for Tasmania, Australia-wide. Launceston didn't have a gradual reduction over 20 years. By the time the problem, because of the basin, and the river valley it's in and the meteorological conditions, air quality in Launceston was quite terrible. The whole town were united behind doing something about this, and there was support from local councils, state governments and the national government. So we had everybody working together at that time. Electricity prices were low. So in the period of about 2 years, the number of wood heaters got halved in this particular town. So we had a period of poor air quality, a series of coordinated interventions, and a period, I won't call it good air quality, it was improved, and it improved some more in the subsequent years. And this is how the air quality data look for that time period. So these, it's a plot of PM10, not PM 2.5, and that's because that's what was measured consistently. throughout this 20-year period. In winter, you can see the seasonal pattern. In winter, the large majority is actually in the smaller size class, PM 2.5. And these bars here, the small dark bars, are the winter average PM 2.5. And the longer bars are the annual average, PM 10, sorry. Winter average PM 10 and the annual average PM 10. The year 2000 was when the interventions were implemented. Wood heaters dropped from 60 to about 30%. And you can see there was very quickly a signal in the winter air quality for the better. Improved a bit, 2001, 2002, clearly much improved. And a drop in the annual average. So the average went from about 47 to 28 micrograms per cubic metre. So later on, that was all done in the year 2000. My team who I was working with at the time, we wanted to ask the question, did mortality rates change? We wanted to see if there was a health impact because of the clear demonstrated improvement in air quality. It's a small town, as I mentioned before, but the only source of data available to us that had been consistently collected through time was actually mortality. It was around 2000 that most of the hospitals in the north changed from paper-based medical records to electronic medical records. So we didn't have access to a consistently collected data set across the 14-year period. Mortality, period of improved air quality with the period 6.5 years before July 2001. And we did that using a Poisson time series regression model, and we adjusted for population age structure, flu epidemics, meteorological factors, day of week. And the one we spent the most amount of time thinking about and doing lots of sensitivity analyses was the secular trends in mortality in the rest of Tasmania. Because, as I'll show you on this next, I'll show you on the figure after this, the long-term trend. But just briefly, we did the identical study in two locations. One was in central Launceston, the central part in the river valley where we had representative air quality data, and the central part of Hobart, where the population again is clustered along a river. And we wanted to see if we could see a change attributable to Launceston's period of better air quality, and Hobart, we really wanted to see no change in mortality rates attributable to Launceston's period of better air quality. So including Hobart as a comparator was to make sure and a test for whether our methods were capturing what we hoped they would capture. So getting back to the long-term trend, this is actually the same plot that I showed just before of air quality, but we've now superimposed the age-standardised mortality rates for Tasmania across the same time period. So deaths per 100,000 population. And if you just look at that, there's nothing that leaps out in terms of a step change. And if you look hard, you can probably see a general downward trend, which is, of course, what you would expect to see, because all over Australia and in many high-income countries during this period, cardiovascular mortality was steadily decreasing for all sorts of reasons. Changes in smoking prevalence, changes in preventive care and managing things like cholesterol, and improvements in rescue care and management of acute cardiac events. So although the population has been ageing and absolute numbers of death have gone up because of that, the rates generally have been decreasing. So to tease this out, we included in the model the trend as a smooth average of the rest of Tasmania, excluding central Launceston, to account for that long-term change. And just to make a point here that Tasmania is small and these towns are small, so the absolute numbers we were dealing with were quite small. So if we take that entire 14-year period, the average annual deaths are nearly 595 during that time in absolute numbers. About a third, a bit over a third, were cardiovascular deaths, and about 10% were respiratory deaths. And then if you split into male and female, the numbers get smaller. We did look at winter. It was a bit optimistic because you can see here respiratory deaths, the average of 17 per winter. We'll be lucky if we see a change in that. And you'll see when I show you the figures of the results how enormously wide our confidence intervals were in this analysis. Okay, so now to some results, and I've got 3 slides and they're all set out in an identical way, and I'll go through this first one slowly with you. But what this shows is the percent change in annual mortality in the period of improved air quality compared with the period of poor air quality. And in every case, red represents Launceston, our town of interest, while blue represents Hobart, which was the comparison town. And the first group is all-cause mortality, and then we separately looked at cardiovascular and respiratory mortality. The bottom panel is identical, but it's restricting the analysis just to winter, the 3 coldest months, which is when the greatest changes in air quality were observed. And as you can see, annual mortality in Launceston, while there might be a bit of a trend to a reduced number, there's clearly no result there to write home about. It's nothing convincing. The reassuring thing is that Hobart didn't change. So we wouldn't expect Hobart to change. We would expect mortality to be the same before and after if we've adequately adjusted for long-term trends. So not a lot to see with the overall results. When we stratified and did the results separately for men and for women, we got a different result. So this top panel here is males only, the bottom panel is females only. And again, red is Launceston, blue is Hobart. And this one in men shows a quite clear difference. So no change in Hobart, but about a 10% reduction in all-cause mortality in Launceston in men, and with a similar trend for the cardiovascular and respiratory causes. And we didn't see anything at all in women. Then we also looked at age group. And again, the results here in the older age group, 75 years and above, we're not seeing much. But, and again, I don't want to overemphasize these results because they are quite imprecise, but the signal did seem to be greater in the 60 to 74-year-old age group. So overall, we're seeing a trend, particularly in men, towards reduced mortality with improved air pollution. And if you think about the known coefficients for long-term air quality and deaths, what we found was in the ballpark of what you would expect to see. And the point I'm making by showing this air pollution pyramid, which I'm sure most of you are familiar with, is that if you're able to see a signal in deaths, that's really a marker of an awful lot of morbidity that's attributable to the poor air quality. So the message is improvement in air quality has the potential to produce large public health gains. Then the next question is, can it be done without expecting people to give up their wood heaters, given that it's a community that you need to keep warm? A lot of people are on very low incomes and we have a very accessible and largely renewable source of energy available. Can we get around the issue of needing to get rid of wood heaters, or can we use wood heaters or use this resource in a way that doesn't cause these public health impacts and pollute so much? So to this end, a series of studies were done, some by myself and our group at the University of Tasmania at Menzies, and others by our local EPA as part of their ongoing community education and intervention campaigns. So there's 4 small towns, their populations 1 to 2,000. Westbury we used as a control town, there were no interventions there. Hadspen had had 2 years previously an EPA-led education intervention in burning more efficiently to reduce chimney smoke. Then in 2014, in the same year, both Perth and Longford got interventions. Perth was run by our group, and that was a mechanical offering a free catalyst to all the people who own wood heaters, while Longford received a education campaign, building on the previous campaigns and what the EPA had learnt from them. And just to show, this one actually doesn't have Westbury, these 3 towns. This is a snapshot of 48 hours showing the hourly air quality in PM 2.5, and you can see the classic winter wood smoke signal, and you can see that the towns parallel each other incredibly closely. So Perth, Longford and Hadspen, you can see Friday night, the hourly PM 2.5 peaked at around 150 in Hadspen, but the night before and the night after weren't as great. So this night might have been a bit rainy or not quite as cold, but the 3 towns do parallel each other. So it was and they're very close geographically, very similar socioeconomically. So it was a nice setup where we could compare air quality with these interventions. So in the town of Longford, the campaign led by the EPA with community education officers, YouTube video clips, a lot of information, stalls at the supermarkets, engaging with football teams and various other community groups. But basically it was an education campaign with the main message, don't shut your flue for 20 minutes, just one single message, and pointing out economic and health benefits from less pollution. And there were draws to win a trailer load of wood and various other incentives for engaging. In Longford, this is Olivia Johnston, the honours student who led this work. It was a totally different approach, and it was to see if a commercial catalyst, pictured here, which has been shown and evaluated in labs, and there's data showing reduced particulate emissions up to 30%, but in laboratory tests where burning is fairly controlled and burning was. So our question, and it was based on a metal-based catalyst that's already used in industry in Australia to reduce emissions from chimney stacks. So it was adapting what was already in use in commercial settings to a domestic wood heater, and simple and affordable. So a good idea, but the question was, does something that can work in a lab in controlled conditions, if you hand it out to an entire community, will you see a benefit? So it wasn't testing the product so much, it was testing a public health or a community intervention. We had a lot of volunteers who roamed the streets in threes. There was a lot of community engagement and posters and media beforehand. So the vast majority of people were expecting this and knew there'd be a free catalyst on offer and were keen to try it. We got lots of testimonials by people who liked it. There were also enterprising young boys who knew this was coming and bought up a few of these things and went around knocking on doors saying they were from the University of Tasmania and here's your catalyst for $20, and were trying to make a buck. So we were running around town trying to compete with these young fellas. The other thing is we placed it in. It was a dangerous activity. You can see this one's burning. So we had a fair idea of how people burn and the amount of ash. So you could see fairly quickly that some were going to get covered in ash, probably within 24 hours, just highlighting the difference in a laboratory and a home setting. So this is a map of Perth, and all the houses that had wood heaters are shown on this map, and the ones that accepted a catalyst are coloured green. The ones who weren't home or didn't want one or didn't collect one in the next 2 weeks are coloured in red. And overall, there was about an 80% uptake. The single outdoor air quality station was located here, roughly in the middle of the community. So then we did Poisson regression again, including looking at we had detailed meteorological information day by day. And so we, similar to what I showed you before, we assessed the change in mean hourly PM 2.5 this time, not mortality, after adjusting for the meteorological conditions in each of the 4 communities. And basically air quality didn't change in any of the community. So in Perth, where the catalyst intervention, in the period following the intervention, the PM 2.5 hourly average was 0.9 micrograms per cubic metre higher. Identical in Longford. In Hadspen, about 5 micrograms higher. Westbury, 1.2. Not really distinguishable from each other. Another honours student did a lot of qualitative and quantitative community surveys at the time, and one result I want to share, this is Richard Webster's work, is that he called or spoke with at least 50 people in each of these communities and many others in Tasmania to ask who recalled there being any kind of campaign at all in their community in the last year. Westbury, 1 out of 50, which there was no campaign there, but there might have been media. The Launceston paper, for example, they may well have been aware of it. Hadspen, 5%. So you would expect that because there were no active interventions in either of these communities. But Longford, 35%, and Perth, 50%. So making the point that it's even 3 months after an intervention, whether the message has been received and people know about it is certainly in this case uncertain, and more people in Longford especially, where there was a huge effort, 65% of people hadn't noticed. Okay, so just to summarise where we're at, what has worked for Tasmania? Certainly removing wood heaters has reduced air quality and very likely improved health. The background tightening of emission standards hasn't had any effect on air quality. Wood heaters, of course, have a very long life in homes. So the newer ones, there won't be that many in operation compared to the ones already there. We haven't had great success with our education campaigns or with trialling simple technology on a community-wide basis. So really that means we're still looking for something affordable and acceptable to the population that doesn't pollute in a foolproof way. How you use the heater, and I think this was part of the issue with the catalyst trial, is if it's buried in ash, if you're burning badly anyway, it's unlikely you'll see a benefit even from something that works. And ideally something renewable. Electricity is getting more expensive and wood heaters are having a resurgence. So it's something we're still working on. So I'm going to leave it there. Thank you for listening, and I welcome any comments or questions. Thanks. Oh, Yoshi, do you want to stop my screen share, or maybe you have?
Yushi, have you seen any questions from the audience?
I can't see any questions from the audience.
I think Yushi's having some technical difficulties.
Oh, okay. But I can see what she's typed. We should look.
Okay, there are no questions. Okay. Well, thank you very much, Fay, for your time and the presentation today. And the CAR seminars will continue next month with Professor Mark Neuenhausen presenting on urban planning and green space. And I'll send out an invitation to everybody a little closer to the time. Thank you, Fay. And thank you, Miwa, for supporting this.
Thanks. Bye.